disorder, substance abuse disorder, personality disorder, you name it. And they present in a different way. But the general consensus is that most of the traumatic patients are very angry, you know, and we find out that people in our community, they're angry all the time, you know, and you always wonder why you're angry all the time. And actually, there's a lot of anger stems out of trauma in early childhood. So there's a distinct relationship between childhood trauma and affective dysregulation, often manifesting in hostility and aggression, and high prevalence rate of bipolar disorder, conduct disorders. I'm not saying that these disorders do not exist just because the trauma was there, and it's all trauma, not these diagnoses. But there's definitely a linkage there. There's definitely a linkage there. Study the long-term effects of trauma. Comorbidity is a rule rather than exception. So when you have trauma, there has to be some comorbidity. So psychological background. This is a wonderful statement I always teach my students about, that in 1985 there's a study, and they assert that abused children display behaviors problems because they understand the world as being unpredictable and painful, and that the adults who care for them are angry, impatient, depressed, and distant. This perception of world tends to transform their children into hostile, violent, and unpredictable persons. So what are the patterns? What trauma usually causes in people? Expecting and infliction of pain or injury from others, expecting, anticipating, being in ways to incite pain and injury, distrusting closeness, feeling hopelessness and powerlessness, development of worriness and suspicion of others, numbing themselves to abuse. When I used to do the trauma clinic, I used to talk about this. If I enter a room with two people sitting in that room, and one suffers from trauma and one does not, and I make a very simple, benign comment, look at you. The person who had no trauma would think that I would complimented them. They would think that I'm complimenting them for what they're wearing or what they're doing. And the person with trauma would immediately get it. What did you say about me? Very personal, very benign. One single statement, two different people, different reactions, right? That's how trauma affects our brains. Become limited to their ability to perceive their own feelings, difficulty interpreting and responding to emotional expression of others. Very difficult, almost like autistic, difficulty perceiving what other people are trying to say. They constantly need reassurances, denying and limiting certain emotional responses, expressing only those with they are most familiar. Aggression, hostility is the main course of action to deal with everything in life. So a little bit of neurobiology of childhood trauma, because I think we should know this. Nobody teaches this in colleges.